Hi there everyone, I'm Dr. Heidi Oja from Aware Orthopedic Health. I'm a physical therapist and I wanted to let you know a little bit about a lumbar spine condition called lumbar radiculopathy. This condition is referred to others as a pinched nerve, sciatica, slip disc, and it's all referring to irritation of a nerve that comes out of the foramen, little bony opening in your back, and travels down into your hip and then your leg. So a lot of people think that if they have this condition or symptoms of this condition, that it's a medical emergency. They need to go to the ER or maybe see an orthopedic surgeon. And sometimes you wait a long time to get into these specialty appointments or be seen in the ER. So I just wanted to let everybody know that physical therapists can competently treat lumbar radiculopathies, and we might be the provider of choice for non-surgical treatment, combining joint mobilization as well as exercise to get you to the other side of this condition. So I just wanted to guide you through a little bit of an exam, what we might do if you were to come in to physical therapy with a lumbar radiculopathy. So first we would take a thorough history, we'd see how your back moves, and we'd be looking to rule out particular conditions that might be emergencies. An example of that could be cauda-equina syndrome, and that is when you have numbness and tingling between your thighs instead of numbness and tingling in front of your legs or feet or back of your legs is not a medical emergency. But if you do have that tingling in between your thighs, in addition to not being able to void or move bowels, so basically not being able to go one or two, that would be a medical emergency. We're also looking to rule out cancer. So if you have a personal history of cancer and the pain when you move doesn't seem mechanical, meaning movements don't bring on your back pain, that might also be a flag, and we might refer you on to get MRI of your back or an x-ray. So I just wanted to tell you a little bit more about the examination, but also what we would do to treat that. So oftentimes, as part of the examination, if we find a specific pattern in the neurological exam where you have decreased sensation, decreased reflexes, and decreased strength of a certain level of your spine, there's ways of testing that, and we rule in that diagnosis as the cause of your pain. Then we would figure out if certain direction of movements would make the pain centralized. So centralized means the pain goes from your foot into the leg back up to your back, and that's what we would want. We want the pain to get closer and closer to your back where it came from. So we would do those types of treatments. We would also combine it with functional training. So for example, say you have back pain and you can't walk and your goal is to run a marathon, we would work with you to come up with a plan and make sure you meet your goal. And so that is a very brief summary of what we might do in physical therapy, but hopefully this tip was helpful. If you are unsure if physical therapy is correct for your particular problem that you have or helpful, we'd be happy to do a 15-minute phone consult. So if you just click on the link below and reach out to us, then we can schedule that, and it might give you some more clarity on the next steps of what you want to do about your condition. Take care.